Hello, everyone. As Dr. Jamil said, my name is Sohrab. I'm one of the medical oncology residents. I just started this year. Hope everyone's doing well. I'm very excited to give this presentation. Just to start off, as everyone knows, our clinical sponsor for this project is Dr. Jamil Asela. I also want to give thanks to our nursing leads, Tina and Adrienne, as well as our pivot nurse champions, Daphne and Virginie. So a little bit about the model that we're doing. It's going to be a multilingual 24/7 support platform that's designed to help patients manage and report their treatment, whether it be chemo or immunotherapy side effects, to the platform, and hopefully it will provide a real-time triage to our team in the morning, provide evidence-based guidance and advice to our patients, and also provide rapid communications to our nurses, to the patients, and the rest of our oncology team. So a little bit of a background of why we're doing this. As our patient volumes rise, so does our chemotherapy scripts. And with that comes more toxicities and treatment-related side effects. Currently, when a patient is experiencing a treatment-related side effect, they're able to call their pivot nurse or triage nurse from 8 o'clock in the morning to 5 p.m. Monday to Friday. Unfortunately, calls after these times are rolled onto the voicemail and addressed the next day. This delays in care, and not only that, it increases anxiety towards the patient. And what ends up happening is that a lot of the time they end up in the emergency department. And in many other centers similar to ours, we found that almost 22% of these calls end up in the ER, whether they need to be or not. So what we want to do is deploy this confidential, multilingual, both in English and French, and hopefully in many other languages in the future as well, AI voice assistants to help manage these oncological concerns in a very timely manner and provide these evidence-based advices and care to the patients during off times. It's important to note that the AI will recognize red flag symptoms such as chest pain, shortness of breath, fever, and in these cases direct the patient to the emergency department closest to them. And before we launch the pilot, we're actually going to be doing a pre-pilot phase where we're going to be testing this model in the daytime with our team against the simulated patients to test the efficacy and safety. We plan on launching a 6-month prospective study where we'll be comparing the calls handled by the AI during the off-hour times to the calls handled during the day, and comparing the differences in ER visits and admissions under 72 hours, as well as looking at some secondary endpoints such as time to nurse callback, patient satisfaction, healthcare professional satisfaction, and most importantly, nursing workload as well. So already, again, in centers similar to ours, there's almost 4,500 calls per year made during these off-hour times. Our goal is to reduce the percentage of this from 22% to 15%, which roughly translates to 315 patients, and also help reduce time spent during the day handling these calls as well, and hopefully producing some cost benefit by reducing ER visits and admission costs for these patients as well. This is a rough roadmap, but we plan on launching in March of 2026 and having the prospective study finished by August 2026. If all goes well, we plan on expanding across hospitals across Quebec and across Canada. And unfortunately, if not, then we'll have to discontinue. But I'm very optimistic, and so is our team. Thank you very much.
Thank you, Sohrab.